Now it's my turn to ask you a question, Norman.
Yes.
This is a medical history pop quiz in the middle of the show. Who said, let food be thy medicine and medicine be thy food?
Probably me, because I enjoy food so much, but I don't. Who was it?
It's attributed to Hippocrates. He probably didn't say it, but where's the fun in that? We can't ask him anymore.
No.
Anyway,
if he ever existed.
Indeed. But anyway, there is a lot of evidence that a good diet of whole foods, fruit and vegetables, that sort of thing, are really good at preventing you from getting sick. But when people start to talk about using food to treat existing diseases, I start to get sceptical, especially when the disease is something as serious as multiple sclerosis. But it turns out there is good evidence that some MS symptoms can be eased with the right diet, along with medical treatments, of course. And I spoke to someone whose research is about helping people navigate the evidence, prompted in part by her own MS diagnosis. Here's Yasmin Probst from the University of Wollongong.
We're really looking into helping people who are already diagnosed with MS to make more informed decisions and to understand how diet and what they eat can contribute towards helping their disease progression. And we've learnt that people would like tools. They would like some things to help them along the way. So we'll be working to create some digital tools that people can use, say on your smartphone, for example, little toolkits for health professionals as well. We know that the support team from the health professionals, plus also the family and the carers of people with multiple sclerosis, are really important to the outcomes for the person. By supporting the health professional to tell the same story about diet and MS, really telling them about the evidence that is there and underpinning what we know about diet and how it can benefit people.
There is controversy in this area. So how can you create an authoritative evidence-based resource if it's still in a bit of a state of flux?
Yes, it's definitely been one of our challenges. We don't start with what we assume. We rather start with looking to see what is the science telling us. And we've done a quite comprehensive review as the basis to this. So we've looked at all of the existing studies in relation to multiple sclerosis and diet or nutrition or food to see what do they tell us. And from there, we were able to work out where can we progress consumer resources and what can we help the consumer to understand where there's already some really strong evidence to show that it should be beneficial for people.
So what sort of things is within that solid evidence base?
For MS, one of the most established areas is the idea of vitamin D. So vitamin D has been shown to be linked to multiple sclerosis risk, but it's also been shown to be related to progression of the disease. It's a tricky nutrient because, yes, we can consume vitamin D in our diet from various food sources, but we can also get it from exposure to sunlight in an appropriate and safe manner. We need to balance out where people are located and then also layer in, are they eating the right foods to get enough vitamin D? And in some cases then also, do they need to have some supplements? So a lot of people with MS do tend to take vitamin D supplements. Another area that is particularly strong and looking very positive is the fatty acid area, polyunsaturated and our monounsaturated fatty acids, making sure that people are aware of the different types of fatty acids, so the food sources of those fatty acids, as opposed to encouraging supplements as the first point of call, but also minimising some of those less ideal fats that we can get in our diet, so trans fats and the saturated fats that can actually create a little bit more inflammation in the body, which is not what we want to have in multiple sclerosis.
Those sorts of things tend to come from what we would think of as being a relatively balanced whole food based diet, which there isn't a lot of controversy around that being kind of good for you in general. Are there any other specifics that might be a bit surprising?
There's nothing that's really out of the ordinary in relation to the stronger evidence base. So in terms of the science, it's telling us what we, as dietitians at least, would expect to be seeing. So foods that are good for you are having positive effects on progression of the disease. So we know that if you eat lots of fruit and vegetables in particular, that has positive benefits for people with multiple sclerosis because they can have some really positive anti-inflammatory effects in the body. We also know that there's been a little bit of controversy out there in relation to including or excluding both the dairy food group and the grains and cereals food group. That controversy hasn't gone away, but we're starting to understand that a little bit more. But yes, the idea of a whole food approach is definitely showing to be beneficial, and common sense sometimes, so reducing the amount of processed foods or junk foods as we might call them, not having as many of those by comparison to some of the foods that might be a little bit better for you. It's, to us as dietitians, almost common sense, but to some people, when it's a very busy lifestyle and when they have very limited time on their hands, grabbing a quick bite to eat is probably the priority, but at the same time, that quick bite to eat sometimes isn't necessarily the best option that they could have chosen.
What could be the mechanism with the sorts of foods that you're recommending and what is happening with MS in the body? Because MS is something that it has to do with inflammation, it has to do with the myelin, the coating on the nerves. Are we reducing inflammation in the body, or are we giving the body the ingredients to reform some of that myelin?
As a person with MS, I think, wow, if we could find a way to help our body remyelinate, that would be amazing. What I'm seeing from the science is really that the studies that are showing positive effects are coming through to say that the foods consumed do have some sort of antioxidant effect, or the interaction of the various foods together, or the nutrients within those foods are having an effect on the disease to help reduce the amount of inflammation that's occurring and the amount of inflammation that's evident. But the challenge we have, unfortunately, in Australia is inflammation comes from a number of different sources, and even being overweight will increase a person's inflammation and the inflammatory response. So sometimes bringing it back to basics and thinking, okay, well, what could I do here? Maybe having a look at weight management might be important for some people over others. Maybe balancing out intake to a more whole food-based approach might be beneficial to others. There are different approaches needed for different people because the disease is quite unique.
How does this role of diet play into the other drugs or therapies that someone with MS would be being offered?
That's one of the good things about food. There aren't too many interactions that are negative in relation to the disease-modifying therapies that people with multiple sclerosis are placed on. So there haven't been any negative reports, to my understanding, in relation to normal consumption of food products and any interactions with the medications. But generally speaking, sticking to moderation, you're sticking to what you should be doing. We've seen that food can actually be quite complementary and can actually help to minimise some of the symptoms that people with MS, despite being on disease-modifying therapy, still are faced with.
So stick to whole foods over supplementation and don't quit your drugs your doctors put you on.
I'd say definitely listen to your doctor. Supplementation, I wouldn't say don't do it. I'd say, again, listen to your healthcare team. Don't start going to the chemist and buying a whole range of supplements to just have everything under the sun, because that could actually cause a negative effect if they're interacting with each other. I think the main thing to keep in mind is that no person with MS is the same as the next. We're all quite unique and we all have some different effects of the disease on ourselves. Even if someone is diagnosed at the exact same time or the same life stage, it's highly unlikely that they will have the exact same progress throughout. Saying, oh, you've got MS, you must be just like Joe down the road. It's not the case for MS, that's for sure.
Yasmin, thanks so much for joining us.
That's okay, thank you.
Associate Professor Yasmin Probst is a Multiple Sclerosis Australia Senior Research Fellow and an academic at the University of Wollongong.